So that study is probably the most common study mentioned every time you discuss HIPEC in any meeting around the world. And it has had significant implications. I'll just be very brief. In this case, that's exactly just like the ovarian cancer study that I mentioned. The idea was to evaluate what was the added benefit of HIPEC after having a complete cytoreduction for patients with colon cancer. And we say, you know, in the scientific world that you design a trial, but eventually you don't get to do the trial that you want. You end up doing the trial that you can complete. And that was part of the problem of this French study called the PRODIGE 7, in which the idea was what I described, to take all the patients, treat them in a uniform fashion, and the only variable being HIPEC or no HIPEC. However, there were a lot of problems since the beginning because patients did not want to participate, medical oncologists did not want to refer those patients, and so the inclusion criteria start getting a little bit more lax. And rather than saying, okay, all patients are going to receive 3 cycles of systemic chemotherapy and then go to HIPEC, they changed that criteria to, okay, as long as they get 3 cycles, as long as they get 6 cycles, those can be 3 before, 3 after, 6 before, or 6 after. So now you're not comparing patients that are exactly of the same category. In addition, there was a crossover. That means that patients that were in the non-HIPEC group were allowed to break the protocol, and not by the French, but mostly by Belgium. They went and other places and got HIPEC after they had a recurrence. But since the study is in what we call an intention to treat, those patients that eventually got HIPEC were evaluated like they didn't get HIPEC. So there were quite a few variables that were not exactly the same. In addition, in order to have more patients, they included centers that, you know, contributed with very small number of patients, just a handful of patients over that long study period, while other centers included hundreds of patients. So the experience was not the same. So fast forward to the punchline. The most important part of that study, in my opinion, is that both groups had a very significant survival of about 41 months, even the ones that didn't get HIPEC. And that shows that there is a role for surgery in this particular group of patients. On the other hand, these findings in countries like Germany put a moratorium in, you know, the ability to do HIPEC in this particular group of patients. But no worries, the Spaniards and now the French again are coming to the rescue by repeating the trial and using mitomycin C for 90 minutes instead of oxaliplatin, that was the drug used on the French study, which is a drug that doesn't have any activity as a single agent, neither does HIPEC for 30 minutes. So a lot of questions about the trial, and I think that is very difficult to conclude any definitive decision based on only one study.